Start. Good morning. Today we'll be talking about the specimens, the Lipoma and the gallstones. Okay. So what is a lipoma? Actually, lipoma is the commonest soft tissue tumor. It usually appears as a solitary, soft, movable, and painless mass. Okay, it appears as a solitary, soft, movable, and painless mass. It is. You can see that lipoma is usually more common in females than males, and the most common sites of occurrence are it occurs mostly in the subcutaneous tissue. So it presents as a subcutaneous swelling. Okay, so that is why you can usually sometimes it can present even intramuscularly or intermuscular. Lipomas are also present, but the most common sites are the subcutaneous tissues in the neck, back, and shoulder. Okay, so neck, back, and shoulder are the most common sites of lipoma. So, by definition, lipomas are defined as a common subcutaneous tumor composed of adipose cells, adipocytes. Okay, so this is lipoma are the tumors of the fat-producing cells. Okay, so it is often encapsulated by a thin layer of fibrous tissue. That is, how do you, when you are describing a lipoma, how do you describe it? It is a well encapsulated, okay, well encapsulated, soft and soft, movable mass. Okay, that is how you describe it. The tumor typically lies in the, as I already told you, it typically lies in subcutaneous tissues, and these are most commonly most commonly they are benign. Very rarely they can get converted into liposarcoma. Okay, and they arise from any age. They occur in any age group. They can occur in any age group. Sometimes it occurs in the children, middle-aged, old-age, anything they can occur. So lipomas are composed of adipose or fat tissue. They are mobile, soft to touch, typically painless and present subcutaneously. They are surrounded by a thin fibrous capsule that is not attached to the underlying muscle fascia. That is important. Okay, they are not attached to the. To mean to say that there are no local adhesions. Okay, so grossly they are soft. It is a soft elio tissue, typically lobulated and with a very thin capsule. Sizes can vary. They occur from small, from few millimeters to big. They vary from a small size to very big size. Okay, they are round to oval, and the cut surface is typically soft, lobulated. What do you mean by lobulated? That is, there are septa are present in the tumor, separating into the different lobules. Okay, it is yellowish and greasy. Typical description is soft, lobulated, yellowish, and yellowish orange. Actually, what do you call it as? Yellowish orange and greasy, because it arises from the fat cells. It is fat is, how is it? It is greasy and soft, right? So it is yellowish orange and greasy to touch. So when you are cutting lipoma specimen, what happens? It is very soft, just like butter, you know, just like butter. It is very soft and very oily and greasy. So this is how a gross picture of a cut section of a lipoma will look like. You can see there's a thin white, this white thing. This is all the capsule, and the picture is looking very glistening, right? It is shining because of the fat. It is shining. Okay. So how about thin, well encapsulated, lobulated, glistening, yellow, and to touch it is greasy. Okay. It usually, when the clinician, when the surgeon sends the specimen and formalin, right? Formalin is the fixating agent. So when it is put down in formalin, it usually, lipomas, how do you identify it? It floats on the formalin, okay? It doesn't sink. If the fibrous component, that is, there is more of this fibrous tissue, like a variant of lipoma called as fibrolipoma, then it sinks. But usually lipoma, how you describe it on crossing is sent a specimen that is floating in formalin. That is how you address it. So it's a well encapsulated, yellowish, lobulated mass with a greasy touch. Yellow to orange with a greasy appearance. So microscopy is, already know the microscopy, right? As a mature adipocytes with uniform eccentric nuclei. That is to say, because the fat accumulates in the cells, it pushes the nucleus to one side. That is what you call as eccentric nuclei. Okay. See here also, you can see the skin because it's a subcutaneous swelling skin with well differentiated, right? Capsule is there. It's all yellow and greasy. There is very little amount of fibrous tissue. Okay. Now coming to the other topic, that is the polylithiasis. Commonly called this, what is this polylithiasis called? Poly means something with gallbladder or bile. Okay, that is what you call. Lithiasis means stones. Lithiasis means stones. Okay, right? So polylithiasis means gallstones. Gallstones, how are they formed? Why are the stones formed? Normally, they're not present in the bile and the gallbladder, right? So gallstones are formed from the constituents of the bile along with, in combination with other organic compounds. Okay. Commonly, they contain cholesterol, bile pigments, and calcium salts in varying proportions. Usual site of formation of the gallstones or the gallbladder. Sometimes they can occur even in the bile duct. Okay. So, why are these gallstones formed? Usually, the constituents of the bile, they are some by some miscellaneous and some lectins. What we do? They keep the bile dissolved. Okay. This bile salts and bile pigments, they remain dissolved in the bile. But when the cholesterol, when it is supersaturated and these lectins and all that, when they can't keep this in a liquid state, then what happens? They form to crystallize. Okay, they form to crystallize, and that is how the stones are formed. Okay, so there are three types of stones: gallstones, cholesterol stones, pigmented stones, and calcium stones. There is other variant called as a mixed stone. That is, they can contain this combination of cholesterol, pigment, calcium in varying proportions. Okay. The pure stones, pure cholesterol, pure pigment stones, and pure calcium stones are there. And there is another entity called as mixed stones. Okay. So, just what are the risk factors? Female 40, 4Fs. Okay. 40, fatty, fertile female of 40. Okay. And another additional is family history. So these are females are at, that is to say, females are at more risk of forming gallstones than the males. If you're fat, you have more chance of developing this thing. Usually in the 40s, 40 fat female, they are more prone to form gallstones. Types of gallstones: cholesterol, I've already told you, cholesterol stones, radiating and crystal-like appearance. Mixed stones, pigment stones are small, black or greenish color because this is due to the bile pigments. Okay, they are multiple and offer sludge-like. Mixed stones are the most common types of stones. They contain cholesterol, calcium salts of phosphates and carbonates, palmitate proteins, and are multiple faceted. What do you mean by multiple faceted? There are multiple surfaces on the stones. Okay. So you have cholesterol stones, mixed stones, and pigment stones. See, this is the bile. Okay. This is the bile salts. This is the bilirubin, and these are the calcium. They are normally present in the bile. Okay. So pigmented stones are formed from bile salts the bile pigments. Okay, cholesterol stones due to there is excessive calcium cholesterol. Then the cholesterol stones are precipitated. Okay, this then the calcium carbonate stones. This is when these form a complex calcium bilirubinate, then the calcium stones are formed. Calcium stones are the ones that can be seen on the X-ray, okay? Because that can be, it's not that they will be, because they're not so big a size to be detected by X-ray. When they're quite big enough, then you can identify these on the X-ray. So, okay, see, now this is how a gross picture of a bile stones, gallbladder with stones look like. So first you have to, you don't receive the gallbladder in the cut open state. It is intact. So how do you describe it when describing the specimen? You have to say it is a specimen of, it is a cholecystectomy specimen, and you should tell approximately the size. Okay, it's a cholecystectomy specimen measuring around 7 centimeters in size, and you should describe the surface. How is the surface? Usually it will be bile stain, because bile is bile is produced in the gallbladder, right? So it is usually bile stain. When you cut open it, you find numerous stones. Okay, numerous stones. So probably the cholesterol stones. See, you can see they're so smooth and glistening, right? Just like the fat. So okay, see the wall of the gallbladder is thickened, very much thickened and fibrotic. Okay, so thickened wall containing numerous stones. See here, these are the cholesterol stones. See, I've told you know that this is what you call it as multifaceted. Okay, multifaceted means multiple surfaces are present. Okay, the complete gallbladder is filled with numerous stones. Okay, so cholecystectomy specimen measuring around 7 centimeters, surface bile stain. The wall is fibrotic and the lumen is filled with numerous stones. These are the pigment stones. See, they are black colored, right? Black colored or greenish colored. Some can be also green colored. Okay. Calcium carbonate stones, they are usually, they have some calcium carbonate. How is it colored? It is white in color. So the calcium carbonate are white colored. Okay. Cholesterol stones are yellow colored. Pigment stones are black or greenish black, and the calcium carbonate stones are white color. Okay, so the wall is thickened and the lumen is containing numerous stones. Okay, that's it.